Among others, can be said a few words about such a peculiar marketing, about working specifically with the financial component. What is important for patients? For patients, it is important cheapness, speed, right? Do you know the joke about that it must be cheapness, fast, beautiful, and I know that I would add it must be forever, not just for a long time, but forever, not painful and high quality. The joke is that the necessary should be emphasized, but from a doctor's point of view, there are several other components. The first one, on what the doctors must often rely when setting prices, on the cost of a dental laboratory. Quite a strange approach, but it is quite widely applicable and often doctors focus on it. But in fact, the market also dictates the price of the work. Because, for example, we cannot offer that prices in Russia, which, for example, are in developed Western countries. Although the cost of our service is quite high, but the market price it most often represents either an adequate or inadequate price. The fact is that the very low price raises a number of questions, not even among the dentists themselves, but among the patients too, because we are now faced with the concept of dumping, when clinics assess fall in price to very low thresholds. But here we must also evaluate the situation straight, because to make something with high quality and inexpensive quality are two such not very compatible moments. All of your study you spent on your education, you spent your time, and therefore your treatment must be expensive. The next moment, time frame. The fact is that I also encounter this in my practice quite often, because some laboratories do it qualitatively and relatively inexpensively, but too long. And here once again it can become much more expensive for us than you take a laboratory which will do quickly and efficiently but take more money, because those funds that involved in the process of our work, the speed of getting a product is much more important than the cost. Because what is 1,000 rubles? Is it a lot or little? You say probably this isn't enough, but if you earn these 1,000 rubles per minute, this is a lot. What is 1 million? 1 million is a lot of money, a great deal of money. But if you get this 1 million within 2 to 3 years, as for clinic, you will not even notice it all. Therefore, total works cannot be cheap just from the point of view of the economy. It's impossible. If total work is cheap, there is either some kind of catch, or people go for advertising purposes or for something else. But for us, for dentists, it's much easier to do from 20 to 30 small works, for example, single crowns or small bridges for 3 units, than to do a great total work that requires complete reconstruction of the bite. It requires a lot of responsibility, attention, and time. Quality in this case for the doctor is not just the appearance of the work, it is an attachment, it is a very multifactorial and very multi-component moment related to the quality of work. And one of these points is also explained and caused by the high level of preparation of the dental laboratory. Not only from the material point of view, that is, the availability of equipment, one or another expensive, beautiful, good material, and not some kind of fake, and so on, but also the hands of a specialist, because training, full-fledged training and the creation of a good dental technician works a lot. Therefore, it is clear that the work of such a technician can be cheap. The guarantee, for example, some patients want to see a very long guarantee. But what we should evaluate, the product in the oral cavity receives a high load. Therefore, a guarantee for a year is fully justified in case there is no technician defect in our work. And in general, all problems are identified quite quickly back in the first 2 to 3 months. Therefore, I would not recommend giving an extended guarantee here, if only from the point of view again, marketing or involving the patients. Please subscribe to our channel, write your questions, we'll be happy to answer them, and as part of our work to explain the most important and necessary aspects for your work. Thanks again, I was glad to see everyone and I hope to see you soon. Thank you very much.